Natal's first babies for the year. These babies are the future of our province. Their arrival reminds us of our shared responsibility to nurture, protect and guide children from the very first day when they arrive. Indeed, how we care for these children today will shape the future, will shape our future and the future of the society at large. At this point, I wish to once again extend our heartfelt gratitude to all healthcare professionals, from nurses, midwives, doctors, cleaners, porters, administrators, and to security staff. Because as we always explain, everyone who works in the health center and in a hospital or clinic in particular becomes a health worker when we categorize them. The arrival of a new year also provides an opportunity for reflection on our own health and the steps we can take to stay healthy. In this regard, we encourage everyone to embrace a healthier lifestyle by following a healthy and balanced diet and also getting into the habit of regular physical exercise. This is one of the areas that as a province we have decided to focus on in this coming year, the issue of a healthy lifestyle. We are going to have a number of different activities, different programs that will target our health workers, that will target our senior citizens, that will target young people, but will target the middle-aged as well and those that are working adults. We have noted that if we don't focus on healthy lifestyle, the non-communicable diseases increase, and as non-communicable diseases increase in the province, it means we have to pour a lot of budget towards that, and these are lifestyle diseases that can easily be dealt with. That is why we have decided that this coming year, the theme for the province of KwaZulu-Natal is Asibe Healthy KZN. So you will be hearing a lot of Asibe Healthy KZN and the Asibe Healthy KZN programs. It will not be just one program, it will be a number of programs, but the intention would be the same towards ensuring that we reduce those that are affected by non-communicable diseases. We have found that a disease like sugar diabetes, for instance, is also beginning to increase very much amongst our young children. And, you know, if we don't do something about it, it means as a province we will continue to have more challenges. We also encourage women to look out for signs of breast cancer, such as foreign lump, sore, mass, or unusual development on their breast. Of course, this is not just for women. Men as well are expected to do the same, because sometimes men are also affected by breast cancer. We also encourage them to get screened for cervical cancer, this is women, and to speak to their healthcare providers about getting a pap smear so that any cancerous cells can be detected early. And as a Department of Health, we provide this service for free in our hospitals and in our clinics, and we encourage women to go and make an appointment so that they get their pap smear test done. Men are also encouraged to undergo screening and testing for prostate cancer from the age of 50 years old, for those who don't have a family history of prostate cancer. But for those that have a family history of prostate cancer, the age is reduced to 45 years. We expect and request men to get tested annually so that we are able to detect this cancerous cells within the system as quickly as possible, and we are able to give the men treatment. We also urge everyone to monitor their blood pressure, diabetes and cholesterol levels, and to adhere to their treatment schedules for those who have been diagnosed. Let us all remember that the early detection and prevention of diseases is crucial, as it saves lives and can prevent serious illnesses from progressing. We have found that over the festive season, those that are on chronic medication sometimes want to go on what we term a holiday, a treatment holiday. That's the word I was looking for. They go on what is called treatment holiday. They say because it's a holiday, it's holidays, we have Christmas, we have New Year, therefore putting their tablets aside for that for a short while. And we want to call and want to make a call to all community members to say, let's not do that. And those that are looking after our elderly who are on chronic medication, please let's ensure that they take their treatment and adhere to the treatment as has been indicated. Those that are on treatment themselves, chronic treatment themselves, we are talking about your ARVs, sugar diabetes, BP, and the list is quite long. Please make sure that you adhere to the instructions that have been given to yourself by health workers, because medication holiday causes a problem later on. You know, from the 2nd of January, these hospital in particular and other hospitals will have a lot of people flocking in purely because they have defaulted from their treatment. And defaulting is not just about ARVs, it's about any other treatment that you are given and you don't adhere to it the way it should be adhered to. So we are making that call that please let's ensure that we take our treatment as it has been given to us. We, on the issue of maternal and newborn health, we want to call upon all mothers and their families to acknowledge that regular antenatal care is critical to the identification and management of any pregnancy-related risk. Furthermore, delivering your baby at a health facility remains essential for reducing maternal and neonatal mortality. We understand that there are those that are at home and some consider themselves to be traditional midwives, but we encourage very much that delivering your baby at a health facility remains essential and crucial so that we are able to observe your child as and when they come into the world. Postnatal care is equally vital as it ensures that both mother and baby are always healthy and thriving. As a department, we remain committed to improving maternal and newborn health outcomes across the province. By the same token, we urge parents to be alert to any warning signs that may require urgent medication attention and to seek help urgently. We also wish to take this opportunity to warn our communities about the dangers of alcohol consumption, especially for pregnant women. HOD have been asked on some occasions that why do I continue to talk about alcohol and particularly alcohol amongst women, and people believe that it has nothing to do with the Department of Health. We beg to differ. It has a lot to do with the Department of Health, especially amongst pregnant women. Sometimes it looks as if I am picking on women only when I talk about alcohol consumption. But yes, we want to talk about alcohol abuse. We speak about alcohol abuse, or we speak against alcohol abuse generally. But we specifically want to say to women, when you are pregnant, if you are pregnant, please stay away from alcohol. There are those that might not be aware that they are pregnant, but are of childbearing age. It also is very important that you stay away from alcohol because you might actually be pregnant and not be aware of it. Like I said, as a Department of Health, we have a vested interest in the intake of alcohol, as it does affect us. Because when a woman drinks while she's pregnant, she jeopardizes the health, development, and well-being of her unborn child. Even if we may seem like we are targeting women, and we are not, but we speak out against this practice because it is important for us to do so. We are just doing our job because alcohol is also a serious societal problem. Of course, that is together with drugs. Therefore, we want to emphasize that there is no safe amount of alcohol during pregnancy. No safe amount. You know, sometimes we get young women or those that are partying to say, if I just take a glass of champagne, because sometimes people think that champagne is less of alcohol than the other kind. But a sip of alcohol to a pregnant woman is just as dangerous as a full glass. So no amount of alcohol is safe at any given time when we are pregnant. Not even one sip. Because alcohol can cause lifelong brain damage and physical disabilities in an unborn child. We also call upon all our communities to ensure that children are never given alcohol or encouraged to consume alcohol. A few days ago, we were shocked and disappointed by the emergence of a video on social media where adults are seen encouraging children as young as 5 years old to consume alcohol. Of course, none of us know at this point where the video comes from, but the fact that it is doing the rounds on social media is of serious concern to us as the Department of Health. Such conduct by grown-up people is extremely harmful to children's development and safety and must never be allowed. It is a sad day when children's health and well-being are sacrificed at the altar of content creation for social media, because it does look like those that were taking that particular video were doing so that they are able to post content. And this affects children adversely. We must never ever chase after social media fame at the expense of our children. Allowing children to consume alcohol at an early age is dangerous, as it damages development and increases the risk of injury, abuse, and addiction. It also increases the likelihood of risky behavior, including alcohol addiction later in life. Therefore, adults must create safe, healthy, and nurturing environments for children. We also call upon families and communities to intervene when children are at risk and report these harmful practices. We are hoping that government is following up, or the relevant departments are following up on that video in particular, because when you look at the video, you can see that there's close to 10 children that are there and are given alcohol. And we don't believe that actually should continue and should not be punished. At this point, I would like to share an update on the New Year's Day babies who have been born across our province. Although the details are still being consolidated, but I can tell you that as of 7 a.m., KwaZulu-Natal had registered a total of 63 New Year babies made up of 31 girls and 32 boys. By 10 a.m. today, the number had grown to 90. This is due to the arrival of 13 more babies and 14 more girls, which gives us a tie of 45 apiece on either side. Okusho ukuthi ke kuyi-draw. 45 girls and 45 boys. The first baby of the year, a baby boy, arrived at 12:20 at Queen Nandi Regional Hospital. He was born to a 31-year-old mother with a birth weight of 1.82 kg. You'll remember I explained on Christmas Day on what is our obsession with indicating the age of the mothers. He was followed by another baby boy 2 minutes later at RK Khan Hospital, who was born to a 33-year-old mother. Our third New Year baby was born to a 26-year-old mother at 26 minutes past 12 at Nteleni Hospital, which is in King Cetshwayo district. The fourth New Year's Day baby was born here at Mahatma Gandhi Hospital at 17 minutes to 1 to a 30-year-old mother. The baby is amongst our 4 New Year's babies in this hospital, Mahatma Gandhi. Of course, we still have mothers that are in labor, and we are expecting more children to come into the world. As more information becomes available, we will continue to share updates on other babies who have started the year with us. While we welcome these New Year babies, we must also register our concern again, particularly over our very young mothers. On Christmas Day last week, KwaZulu-Natal recorded a total of 302 births, which was made up of 166 girls and 136 boys. Alarmingly, 70 mothers within these 302 were teenagers, with the youngest being the 3 15-year-old girls that we spoke about. Among these young mothers was a 16-year-old girl who was impregnated by a 32-year-old man. So far, the youngest mother of our New Year babies are 2 16-year-olds who gave birth at Benedictine Hospital under Zululand District and at Queen Nandi Regional Hospital under King Cetshwayo District, respectively. This 16-year-old doesn't make it any less problematic, because when she gives birth, or when they give birth at 16 years old, it means they fell pregnant when they were 15. And that is a serious problem, a serious problem that we are faced with. In both instances, the fathers are 21-year-olds. What is also concerning is the fact that these girls were 15, just like I said, when they fell pregnant. We have had a total of 13 teenage mothers, including one 17-year-old Enyukasela, 4 4 18-year-olds, 1 Prince Msheni, 2 Emseleni, and 1 at Queen Nandi, and 2 19-year-old mothers, 19-year-old mothers at 1 Mahatma Gandhi and the other one Eshowe Hospital. These statistics are cause for deep concern and highlight the ongoing need for education, guidance, and access to reproductive health for teenagers. As government, we provide this information. As government, we provide this education. But we can only win this battle if we are able to work together with society. We can only win this battle if we are able to work together with parents, because they are the ones who are providing guidance to children and teenagers at home. So please, we are really making a serious plea that we take the matter of educating our young ones very seriously as parents. Let's not give away our responsibility, or let's not abdicate our responsibility as parents to government. Government has a role to play, and yes, we expect government to play that role, but as parents, we also have a role to play together as society. So we are making that serious call again to our society and to our parents. While it is critical that we work together to prevent teenage pregnancies and support young mothers, in order to make our provincial teenage pregnancy strategy work, we must also ensure that every child born is given the best possible start in life. So as the Department of Health, once a child is born, regardless of the age of the mother, we have a responsibility of ensuring that that child gets the best possible start in life. This begins with proper care, nutrition, and protection from diseases, which are essential for healthy growth and development. Let us now turn to the key steps parents and caregivers can take to safeguard the well-being of their newborns through breastfeeding, proper nutrition, and timely immunization. Exclusive breastfeeding for the first 6 months strengthens immunity, supports brain development, and protects against infection. It is important. We need to make breastfeeding fashionable. We are aware that some young mothers don't see this as a good fashion statement to breastfeed, but we want to say breastfeeding is important, therefore breastfeeding must be fashionable. Proper nutrition during the first 1,000 days lays the foundation for physical, cognitive, and emotional growth. We call upon parents to monitor growth charts and attend regular weigh-ins at clinics to ensure their baby's healthy development. Vaccinations protect children from preventable diseases such as measles, polio, and tuberculosis. Therefore, mothers must ensure that the Road to Health booklet is updated and that no vaccination appointments are missed. Let us forget what has been said or the misinformation that has been provided and put out there, particularly on social media, about vaccinations. Vaccinations are important. Vaccinations are the reason that most of us were able to fight measles. Vaccinations are the reasons why we have eradicated polio in South Africa, and we are able to address and deal with tuberculosis. Ensuring that children grow healthy and protected is only one part of safeguarding our communities. Equally important is protecting adolescents and adults from HIV, which continues to affect many families in our province. In this regard, we are excited about the introduction of Lenacapavir, a long-acting injectable PrEP that will soon be available to strengthen HIV prevention efforts. This, we are informed by our National Department of Health that it will start being available to us in February. And we are calling on community members who feel that they are at risk, who feel that they might need this injection, to come forward and start register, so that when the injection becomes available in February, then they are able to get the injection. As provinces, we are all expected to launch this Lenacapavir injection. We have started as a province of KwaZulu-Natal with our own launch. We were in Newcastle 2 days ago. Was it 2 days ago? 2 days ago to have this launch. We are going to continue with our road shows in the rest of the province so that people are aware of this injection and people know that it is available and when they are going to be able to get it. This injection is a game changer in our fight to curb the spread of HIV. But because this word is long and may be difficult for some to pronounce, we've just decided to simply call it Ulena. So uma befika abantu, they must just come and request Ulena, and then all of us, we will know what are they talking about. Administered just twice a year, Ulena simplifies adherence while offering strong protection for HIV negative individuals. It is important to point out, though, that this injection does not protect against other STIs, nor does it prevent pregnancy. So condoms and family planning remains essential. We will continue to conduct awareness campaigns throughout the province, like I said, ukuze abantu bamazi Ulena, so that they get our communities get educated on its safe and effective use. As I conclude, I wish to say let 2026 be a year of prevention, protection, and nurturing for every child. We continue to call on families to make healthy choices, attend clinic visits, and create safe environments. We call upon communities and leaders to support parents and safeguard children from harm. And please remember that prioritizing our own health ensures that you can effectively you can care effectively for your child and loved ones. Finally, we want to say, as of the first today, we are also very excited to announce that we will be receiving 1,200 community service personnel, which is made up of nurses, doctors, and allied health professionals. That is for the whole province, 1,200. I thought we were going to get clear. We are also receiving medical interns in various hospitals across the province. They will also be starting work tomorrow on the 2nd of January. We thought it's necessary for us to indicate this in particular because in the last few weeks of the year, November and December, there has been some confusion on whether the province of KwaZulu-Natal will be getting any ComServes or will be receiving any medical interns. In fact, there was a voice note or a message on social media that was saying as the year is starting, there's not going to be any medical interns in this province and there's not going to be any doctors that are going to be accepted for ComServe. So we want to say with a very serious excitement that is not true. And indeed, they are going to be starting tomorrow, and we hope that the 1,200 that we are receiving will be able to assist us towards the service delivery that we have a responsibility of providing. Thank you very much, ladies and gentlemen.
Good news indeed. Thank you very much, MEC. I will allow the media houses to ask questions if they have any questions. You introduce yourself and say the media house that you come from and ask your questions. And I see by the show of hands. Okay, we are both noted. We'll start this up. Thank you.
Thank you very much. Good morning. My name is Ngosi Khona-Malinga from ANC. MEC, just on the issue of teenage pregnancy. Sure. So, for example, in the December 25th case of the 16-year-old and 32-year-old, is there any legal recourse in such instances? Because we've been hearing some civil society groups essentially call for the prosecution of such individuals, i.e. the 32-year-old. In your knowledge and to the best of your ability, is there anything the government can do in ensuring that those individuals are held accountable to whatever extent? And just on the second issue, well, the second question related to that particular issue, just around your understanding of, moreover, the role of a parent and a family, the role of the community as well, and in some instances like KwaZulu-Natal, where we speak of deep rural areas, the role of traditional leadership as well in some of these scenarios that we see. Just a last one, diverting just slightly. What has been the department's assessment of response during the festive season in terms of your facilities and your emergency services as well? Thank you.
Let me see, can I propose that you answer this one, or you want to take it?
That's fine. That's
Maybe
fine.
let's
Okay.
answer this one and then come to.
All right. No, thank you. Let me start with the legal recourse. The law says any child that is 16 years and below does not have the legal standing to consent. Therefore, anyone who sleeps with someone who's below 16 years is raping that child. Is raping that child. So certainly the law is there, and the law provide a way out. There is no consent. There can never be consent with someone who is below 16 years. Of course, under normal circumstances, you would think that it would be easy for the Department of Health, when the child comes, the father comes, we just arrest the father. Unfortunately, that is not our mandate as a Department of Health. Our mandate is to ensure that we provide a service to mothers, all mothers, that come to our facilities without any prejudice. However, that doesn't mean we are not worried, as I've been saying, and we have made sure over the past year that the provincial government comes up with an anti-teenage pregnancy strategy that will include all the departments that should be able to come together to deal with this matter. That is the Department of Health, the Department of Education, the Department of Social Development, and SAPS. Now, we have a responsibility when the mother comes to our facilities to bring on board social development, and social development then comes on board together with the SAPS so that they are able to address the matter and follow up on this case. All we can do is lobby the parents as a Department of Health. All we can do is lobby the parents to say, make sure that this matter is taken up, go and open a case, report it, but we can't force them. We did try a few years back to actually become more active as a Department of Health in ensuring that those that are statutory raping our children actually face the arms of the law. And the outcome or the side effect of that was that the children were no longer happy or willing to come to our facilities. Therefore, while we thought we were doing something good, we were also affecting the young ones, because then they started giving birth at home, they started not attending our clinics, and that is not what we want, because if they don't attend our clinics and they don't give birth in our facilities, they are putting themselves in danger. So we then had to find a way of balancing the two. And the best way of balancing is that we ensure that all the departments that are affected or have a role to play, they come on board. Like I said during Christmas, we will definitely we will have a session really when the year starts with the other departments, so that we find a way and ensure that they do what is that they need to do. The role of communities and community leaders in particular is extremely important, because when you look at this 16-year-old, for instance, that was impregnated by a 32-year-old, we often find in such instances that because these old people who impregnate young children often are well off, they have money, and they easily go to the families to say, we can come and pay damages, or we can come and pay lobola for this child. Now, the role of the traditional leaders in particular is to assist us to say, there is no damages that's going to be accepted for a 15-year-old, for a child, for a 14-year-old, for a 16-year-old. That is the role that we believe traditional leaders must be able to assist us with. And we have been engaging with them on a number of instances, and they are quite willing to work together. So we are really trying to get towards ensuring that we work together properly to ensure that our communities understand that this is rape, And rape is rape. It must be called for what it is. There can never be any damages for raping someone. But we also call on community leaders, particularly traditional leaders, to engage with young men. Young men must understand that they must go and engage with people their own age. I am not even talking about the old men who are married and are predators and are sleeping with children. So the relationship and the program that we must have with the traditional leaders is engagement with young men on what does it mean to be a man? And if you start being sexually active, what is an age group that is correct for you as a man or as a young man? But we also want traditional leaders to assist us with those men that, or old men that are in society. Some of them are married, some of them, are not married but are just abusing the children, because it is abuse. We must call it for what it is. It is total abuse. There is no way that a married man can go and have sex with a 16-year-old or a 15-year-old and we celebrate as a society and we celebrate as a community. So it's important that our traditional leaders assist us in mobilizing the society and the community to understand what is this challenge that we are faced with. As you know, like you correctly said, civil society is also beginning to be active around this space. We've agreed with the leadership of the civil society that we are going to have an engagement beginning of the year so that we start running programs together and go out to communities and to young people in particular to sensitize them about these challenges. The last question that you asked was, what was the impact of the festive period? Well, you know, our facilities are always very packed. During the 24th, the 25th, and the 26th, the 31st, and the 1st. But we have seen a bit less on accidents this year in particular. When we look at the statistics that we've been given, and of course we are still going to consolidate, we've seen just a bit less of those. We have seen a lot of stabbing, as it has been the case. We've seen in the previous years, we've seen some gunshot wounds that have been coming in, but a bit less on accidents. I'm not saying there's not been any accidents at all, but I believe what the Department of Sport is doing in relation to ensuring that those that have been drinking are not on the road should be supported, and they should continue with that campaign. I'm quite happy that they started the campaign early as they did, because then it made everyone aware that if you come on the roads of KwaZulu-Natal and you are drunk, you're going to be arrested. We don't look at who you are. We've had some doctors arrested. We've had some municipal managers arrested. We've had teachers arrested, lawyers arrested. So everyone falls under the same treatment, and that we are very happy with, because it then means people will now start taking responsibility for their well-being and for our well-being on the roads, because more than half of the accidents that happen on the road are not as a result of that particular driver, but are as a result of a drunk driver who got into their vehicle and came into our roads and then started causing accidents on the roads. Yeah.
Thank you very much. Over to you.
We covered my first corner, but maybe just to get a bit more of, sorry, I'm Danilo just to get a bit more detail on the baby boy, the first baby boy that was born, maybe the stats in terms of the weight of the baby, and when you look at the deliveries that we've had, they're all healthy, delivered well. Any issues that maybe are worth noting that maybe you need to, going forward, as you push the campaign for mothers to attend their prenatal classes or treatment?
Yeah.
What exactly are we looking at in terms of the health of the mother and the babies that are being
So we've had, of the numbers that we've given so far, some were natural births and some were cesarean births. And you know that cesarean births, normally it is known right at the beginning of the birth, if the mother attends our clinics, then it is known that that mother will have to go through or will have to deliver through Caesar, and they are prepared for that in their heads. Yes, it is definitely extremely important that we get our mothers to attend to our facilities, because if they do that, then we are able to give them the treatment that they need to receive. Because remember, when you are pregnant, we also have to look at your comorbidities as a mother. And once we see your comorbidities, then the doctors and the health workers are able to give you a treatment that is actually meant for you and the conditions that you have as a mother. So it is very important that mothers attend to our facilities. And you are right, we are going to continue with the campaign of encouraging pregnant women to come to our facilities as early as possible. Because if they come as early as possible, then we are able to give them the treatment that they need as mothers. If they themselves are HIV positive, we are also able to get them on treatment so that the baby is born negative. And if you don't come to our facilities earlier, that then sometimes becomes a bit of a problem. So we will continue to run that particular a campaign moving forward, and we have been running it, but we'll continue to run it this year. All the babies that were born today have been given a clean bill of health, and we are very happy with that. The first baby that was born this year, the boy that was born at Queen Nandi Regional Hospital, was born to, I said it was born to a 31-year-old mother, and the weight was 1.82 kg. So he's a healthy baby boy, and we are very happy about it.
Thank you very much. If there are no further questions, I'll request MSC to wrap up in the Isengoni. Just especially on the stats.
All right. No, siyabonga kakhulu, sibonge nje ukuthi sinani. Njengoba sishilo siyafisa ukufisela abantu bonke abangena unyaka omusha ukuthi bangene kahle, bawudle kahle unyaka omusha, bazinakekele. Sishilo ke ukuthi kulonyaka njengomnyango wezempilo sizozama ukuthi sifocuse einhlelweni ezibheka ukuthi abantu bakithi bayaba healthy. Ukuba healthy ke akusho ukuthi uze esibhedlela, senzela ukuthi ube healthy ungakafiki. Ilapho esithi silauncha khona icampaign yethu esithi ebizwa ngokuthi asibe healthy KZN. Le campaign ke izoba sithathe simikise ezikolweni, sithathe simikise kubantu abadala lapha abahlala khona, noma besemakhaya, noma bekuma luncheon clubs abo, labo abawasebenza ababakuona uma ngabe kusemini. Sithathe icampaign sekulabo abasebenzayo who are of middle age. So sifuna wonke umuntu abe active. Sizokwenza indlela ezihlukene ke zama programs. Nizosibona sisiningoma, ngoba na usiningoma usuku exercise. Nizosibona sigijima, nizosibona si walker, senza ama aerobics, senzani yeah. Azoba khona ama aerobics. UMaphisa angimazi noma uzokwenza ama aerobics ngesuit yakhe, kodwa uzombona naye. We'll be hiking as part of our campaign. Hiking ke siyayazi ukuthi ukuhamba nje ukhuphuka entabeni noma uhamba distance. So maningi ama programs esizoba nawo, senzela ukuthi si emphasize udaba lokuthi asibe healthy KZN. Uma siba healthy ke asigcini ngokuthi kube healthy society kuphela. Nabasebenzi bezempilo siyafisa ukuthi nabo babe yipart ye campaign. Sesike sayiqala I campaign ye hiking nabasebenzi bezempilo sisothukela districts. Sizoqhubeka nayo in the rest of the province, ngoba sifuna wonke umuntu akwazi ukuthi aphile impilo healthy. The reason why siqinisa kwi campaign yethu yokuba healthy, asibe healthy KZN, yingoba uma singabi healthy, singanyakazisa umzimba, singayivocavoci, lokho kueda kuma non communicable diseases. Lama diseases sikhuluma nge disease efana nesifo sikashukela, iBP, you know, cancer and so forth. Kubalekile ke ama disease anjalo siwana ke ilawo ama disease siwabiza ngokuthi ama lifestyle disease. asiphatha ngenxa yokuthi thina sidla kanjani, siphila kanjani, umzimba wethu siwunakekela kanjani. So kulonyaka ke sifisa ukuthi sonke sibambisane neKZN sibe sibe naleyo campaign esiyenzayo. Nizosibona ke sifaka ama-short sigijima lana, ningamangali kakhulu nibuza ukuthi kwenze njani ngoba siyobe si-exercise. Siyafisa ke ukuthi sisho ukuthi kulesikhathi as of 10 namhlanje sibe nezingane eziwu-90. Siqale ngo-7 siqale sineyingane eziwu-63 ezifikile kulonyaka, eziwu-31 zamantombazane, eziwu-32 zabafana. Kodwa by 10 o'clock this morning inamba yethu ibisikhuphukile yaya ku-90. Njengoba ke iku-90 kusho ukuthi ku-edwe iy'ngane eziwu-13 ngaphezulu, iy'ngane eziwu-13 ngaphezulu zabafana neziwu-14 zamantombazane kuleyo namba. Okusinikeza ke u-45 sike sasho ukuthi kusekugcine kuyi-draw. Okungenzeka ke kodwa ukuthi sesidlulile ke manje ngoba asikabi nayo i-update njengoba silana, ngoba uma sihleli lana kusuke kukhona omama abasuke behelelwa, igama eli-right lesizulu, behelelwa ngaleso sikhathi bezodeta. So as sikhuluma iy'ngane ziyanda ziyafika emhlabeni. Sitheke ingane yethu yokuqala ifike ngo-12 ekuseni namhlanje, bekuyingane yomfana evelele noma ezalelwe eQueen Nandi Regional Hospital. Uma wayo uneminyaka ewu-31, bese yona ingane qobo ibiweya u-1.82 kg. Elandelayo ingane nayo futhi bekuyomfana ezalwe 2 minutes later than ngamanye amagama beku-12:22 uma ngabe ifika lengane. Uma wayo yona una 37 years. Eyesithathu ingane efikile izalwe umama ona 26, yona ivele ngo-12:26, ivelela Entseleni Hospital eseKing Cetshwayo District. Eyesine ingane evelile ifike ngo-12:43, izalelwa khona la isibhedlela esikusona iMahatma Gandhi to umama oneminyaka ewu-38, umama oneminyaka ewu-38. So siyajabula ke kakhulu ngalezo ingane. Siyafisa nje ukufisela omama abalethe ingane ezintsha emhlabeni namhlanje impilo enhle, impilo ende. Sithi abayiphathe kahle ingane njengoba sifikile, kodwa sifisa ukukhuluma nabo bonke omama ukuthi ubisi lwebele iyona nto ebalulekile, iyona nto ekhulisa ingane. Kubalekile ukuthi ingane zethu zidle ubisi lwebele ngoba ubisi lwebele linomsoco wonke odingwa ingane. Yingakho uma sifika sizobeletha, onesi bayaye basitshele ukuthi si breastfeed exclusively, okusho ukuthi si breastfeed ingane uma sikwazi kuphela, singafaki lutho kunye. Kodwa uma ngabe ungakwazi ukuyi-breastfeeda ingane, bayaye bathi onesi ungaxubi ubisi lwebele nobisi lwekani. Uma ngabe ingane uyiphuzisa ubisi lwekani, ayiphuze lona. Uma uphiza ubisi lwebele, iphuze lona. Kodwa njengomnyango wezempilo si-encourage ubisi lwebele ngoba ubisi lwebele linayo yonke into edingwa yingane. Okugcina siyafisa ukuthi sithi komama iy'ngane uma sezivelile abahambe bayozigoma. Umgomo ubalekile. Siyazi ukuthi ngesikhathi se-COVID kwakukhona information eningi okwakhulunywa ngayo ngemigomo ehlukahlukene. Siyafisa nje ukusho ukuthi akulona iqiniso konke lokho okwakukhulunywa ngakho ngaleso sikhathi. Sifisa ke ukuthi izingane zigome ukuze zikwazi ukuthi ziphile. Ziningi izifo esesikwazile ukuthi siyinqobe ngenxa yomgomo. Sifo esifana nepolio nje, ontanga bethu namhlanje akekho ongathi usayazi ipolio ngempela ngenxa yokuthi sinomgomo, izingane ziyagoma, ayisabonakali, sayi-eradicate ukuthi iyaphela eSouth Africa. So kubalekile ukuthi izingane zethu igome so that zizokwazi ukuthi ziphile. Sengigcina ke ngiyafisa ukuthi siyajabula kakhulu ukuthi sizo-welcome abasebenzi bezempilo aba-1200 kulonyaka. Ama-medical interns azobe ekhona ComServe, ama-ComServe yilaba ke abasebenzi bezempilo abasuke bezokwenza i-community service. Lapho sinodokotela, siyonesi, sinama-allied services ewonke abakhona. Ngifisa ke sengisho kulokho ukuthi siyakubalula lokhu ngoba sizwile ekupheleni konyaka ukuthi engathi bekukhona i-information ebihamba kuba social platforms ikhombisa noma isho ukuthi umnyango wezempilo kwaZulu Natal kulonyaka awuzothatha ama-ComServe, awuzothatha futhi ama-medical interns. Akulona iqiniso lelo njengoba sishilo ukuthi namhlanje or as of tomorrow kuzoqala u-1200. Siyajabula kakhulu, siyabona ukuthi yonke lo number izosisiza ezibhedleleni zethu zonke zu-69 ziphelele. Abanye bazogcina besiza ngisho nasemaklinik. Siyababongela kakhulu, siyathemba ukuthi bazokwazi ukuthi bazocontributor kahle eyintweni esizenzayo thina ne-responsibility yethu njengomnyango wezempilo. Thank you so much.
MEC, I would request that we allow the media houses to go if they really need to go and file. But if they want to stay, we will still have a talk, internal talk. They can stay outside and wait for us whilst we. Are we still going to brief?
No, we'll brief. We'll have a briefing after.
After the talk.
So let's go see the babies first.
Oh, let me see like so. So let's go see.
Let's see the
talk and
babies.
then we'll come back.